Let's speak to Dr. David Nicholl. He's a consultant neurologist in Birmingham and a committee member for the Doctors Association UK. Thanks for joining us. Your view on this idea?
Well, then, it's a mind-numbingly dumb dead cat policy, which is, if that's the best you can come up with, the NHS is more screwed than I thought I was this morning. I mean, it just makes no sense at all. Bearing in mind, this is a man who his manifesto commitment was to increase GP numbers, and we know GP numbers have fallen, okay? His focus should be on staffing, and yet when Jeremy Hunt, in fact, suggested an amendment in November that we should have a workforce planning on NHS planning, Rishi Sunak vetoed it on the grounds of cost, and 280 MPs voted against that in November, and that's the mess we're in. And it's not evidence-based as well. Nice study that was done in Israel, actually looking at daycare centres, and daycare centres got fed up with parents turning up late, so they introduced a $2 a minute fine, and actually the number of latecomers went up. And that's before we even talk about the cost of all this. So actually, in terms of red tape and things, it's just going to, it'll be a complete waste of money. And also, finally, I think it's discriminatory for the some people who are most vulnerable. As a neurologist, if I look at my own DNA rates, it's always greater in those patients, for example, who've got a head injury or epilepsy. So if we're saying that if someone has a couple of seizures, miss a GP appointment, do they get fined? See you in court.
Okay. Tell us about the red tape, though, if you did try and introduce this. Why would it be so time-consuming?
Well, GPs would then be distracted into spending money chasing up the fines on these people. And
would it be up to the GP? Would it be up to the doctors to chase up the fines? Surely it would be up to the government.
Or you need to appoint a manager to run this service. Okay, so actually taking money away from direct case. So that's why I say it.
Maybe we should fine them 50 quid, and that would be better, and therefore we wouldn't lose money.
Then you just see the end of the health service. This is a distraction from the things we should be focused on, which is staffing, and why you're getting why the GP numbers are falling, and that's an issue in terms of retention. The failure to deal with the pension issues, which again, as Chancellor, he could have dealt with and has failed to do so. Also, some of the issues the Doctors Association are raising about indefinite leave to remain. So, GPs that have come from overseas, trained in the UK, and are potentially facing deportation. I mean, it's just stupid.
Okay, I can hear you don't really approve of it. Let's talk about staffing then. If staffing is really the key to all this. I'll ask you about the finances of that first, but in a second. But first of all, how are you going to attract more people to become not just GPs, not just neurologists like yourself, but particularly nurses, social care, occupancy? Where do I start, to be honest? How are we going to get more people into the NHS?
Well, it's actually recruitment is good. It's retaining is the problem. Okay, so it's trying to deal with the pensions issues, for example. And a lot of people are feeling burnt out. In fact,
what is the pension issue?
Well, the issue on this is that high earners, it actually ends up that you end up being taxed going to work, basically, and so people are reducing their hours to avoid
taxed for going to work. How do you mean?
Because the pension liability, okay,
right?
Because they reach the top limit, so it actually limits the ability of people to do waiting list clinics, which will help deal with the backlog, for example.
Right.
This has been raised repeatedly by ourselves in the BMA for years. Basically, it still isn't being dealt with. And also the retention issue has been significant because a lot of staff are burnt out. This was actually put most eloquently by David Oliver, who got elected as the president of the Royal College of Physicians and actually turned on the post because he got COVID in March and just didn't feel he could take on such a high-profile job, basically. And there are many, many hundreds, if not thousands, of staff as well who are reducing the hours because they just feel burnt out for the last couple of years.
I'm from a medical family. I remember my dad, God rest his soul, was always moaning about the funding and particularly moaning about how much management there was and it got in the way of the clinicians, etc. We've always moaned about the health service. Are we really saying that it's worse now than ever?
I've been a consultant 20 years and it has got worse. So I put an example on this. Last week, the waits in Birmingham in some hospitals, I saw a chap with a new diagnosis of Parkinson's who'd waited 77 weeks to see me.
Really?
Okay. 77 weeks, okay?
Is that something to do with the pandemic getting in the way?
Backlog, absolutely. Problems with having face-to-face appointments, and obviously something like Parkinson's disease, you have to be able to see the patient. You can't just do that in a phone call. And that has been a big issue. And also, I think that's actually had an effect on all of us in terms of even just the mental health crisis. There's been, I think, a lot of people have suffered. Patients have suffered mental health-wise. For my Parkinson's patients, you've got a progressive condition. So they've been told to lock down, okay, and are physically deconditioned as well. So all kinds of issues. And, these are issues in terms of staffing, which your father was right, we did have an issue before the pandemic, but it's got a lot worse.
Okay. And do people miss appointments with you as a consultant neurologist?
Yes,
Really?
that happens. I've changed my policy on that to some extent.
Right.
Is that if someone doesn't turn up, I ring them up, okay? To just check where they are.
Okay.
Sometimes that scares them a little bit because I'm just trying to find a car park space.
Oh, okay.
But
I have to pay for that.
But actually, often the issue is just you've got the wrong phone number. It's been recorded, so it could be logistical issues. But going back to my comparison with epilepsy, I think it's a very real issue that this policy could be discriminatory actually to some of the most vulnerable in society. So no purpose whatsoever.
Okay, I'll put that to the audience. Thank you so much, David. Dr. David Nicholl, he's a consultant neurologist in Birmingham. He's a committee member for the Doctors Association UK.